After 9 months of the osseointegration procedure, my dental implants will be completed in the next few weeks at the Oaks Dental Clinic in Seoul, Korea, which is close to Gangnam Station. Join me and I'll demonstrate the procedure for you. We're heading to my dental surgeon and we ran across this shopping underground at Gangnam Station. They have a slew of underground shopping center. In order to avoid being late, we arrived at the clinic 15 minutes prior to my appointment. 15 minutes were spent waiting as they prepared the surgical supplies. Started off by filling up some forms for assessment, and those are the dental surgeons in this clinic. In order to find the implants on my lower gums, they first took a 3D x-ray.
It's just two, correct?
Yes.
Yeah, okay.
She has one already in upper.
Yeah.
Yes.
Yeah, so we're gonna start. You're okay with it, and then
No,
we
I
also
don't wanna watch.
explained. Did we explain also all the pricings we've explained?
Process with implants begins with the application of Novocaine to the gums. This phase was simple. The surgeon would attempt to make an incision to reveal the implants. To ensure I don't have any discomfort, he administered extra Novocaine. And he is securing the healing cap with screws. And he made another incision because it still doesn't fit nicely. Honestly, I detest having my mouth open wide for extended periods of time because it's really uncomfortable. And finally, he will screw the healing cap to the implants after it fits snugly. Repeating the same process for the second implant, putting Novocaine on as the first step. Honestly, I had a lot of difficulty with this one and experienced agony because the implants were already too deep. To reveal the implants, he is starting to create another incision. This took some time because the implants had to be made with a custom abutment because they were too deep and not straight. It took a little bit longer here, so after he eventually revealed the implants, he stitched up the area. This feels awful. When the dental implant's metal post is inserted, the abutment is fastened to the metal post. You won't require a second surgical procedure then. However, because the abutment protrudes past the gum line, it is noticeable when you smile, and it will remain that way until your dentist completes the tooth prosthesis. The next step is to take an x-ray to confirm that the healing cap is correctly in place and to determine whether tooth molding may proceed. Since everything is fine, they will begin creating the crown mold. After the abutment is placed, your gums must heal for about a week before the artificial tooth can be attached. Using a 3D x-ray, it is possible to determine whether the surgery went smoothly and without any issues. Today is the finale of my dental implants and we're waiting for the bus. So it will take us 1 hour to get there to my dental clinic, and finally I will have a complete set of chompers. I will show you some snippets on how they're going to install those crowns, and I'm so excited about it. Without further ado, let's go. This is my dental clinic where my dental surgeon is. So we're done eating breakfast, so let's get in. We're just waiting, so they just let us sit first and they will just call me up in a few minutes.
We're just gonna remove the stitches. Okay.
The healing cap is called as such because it's designed to induce healing of the surrounding gum tissue. After a few weeks have passed, the healing cap is then taken off. The abutment mentioned earlier is now put in position in order to serve as the supporting component for the finished crown, and the abutment is required to guarantee a secure fit for the crown that won't be easily moved by forces exerted by human biting.
Crown at the bottom of my molars, you see that? That one and that one. Yeah, those white ones are the crowns, dental implants as well. So we'll do the finish the last two implants.
This is the day that the zirconium crown will be fitted. They must remove the healing cap and fix the abutment before they can begin. Depending on how you bite, they may need to reduce the size of the crown to ensure that it fits your gums and allows you to bite properly. Getting another x-ray to check the implants. Fitting the crown on my right is a lot easier. It took only a few minutes to finish this one. The surgeon will test your bite if it bites properly. They used a tooth floss to ensure the floss can glide on your tooth and it is not too tight or close to the other tooth. This side I felt a slight pain because they need to push the floss harder, and it took a little while because they made a huge adjustment for my bite. Hence, they need to reduce the size of the crown. Ouch, this really hurts, honestly. And another round again to push the floss. Oh my god. And testing your bite again to ensure it fits already and it's okay.
Fight and hold.
Finally, after prolonged agony, the crown already fitted and the dentist is trying to fit the crown and screwing it, and it's done.
화이트 다 약하네. 화이트. 오케이. 네. There will be some problem. Okay. There's no problem. Okay, using it several days. Let's take one more time. Okay.
Okay. So I have one last appointment on August 9. They will have a bite check and that would be the final. So they want to know if I feel comfortable with my teeth, with my new set of chompers. And we're finally leaving this clinic. So I'm happy and then we're going back. So thank you for watching. I hope you learned something. If you have any further questions, just please subscribe and leave any comments down below and I'm willing to answer those questions. Love you all. See ya.